Good afternoon, everyone. I am Dr. Vinod Kaushik from IAP Media team. I will be the host for today's webinar on the topic The Evolving Role of Physiotherapy in Healthy Aging, a comprehensive genetic care being organized by IAP Women's Health Tamil Nadu branch to celebrate the World Physiotherapy Day. The Indian Association of Physiotherapists is the oldest and the largest association representing physiotherapists in India since 1955. The IAP digital media team consists of a group of physios who handle Zoom platform, webinar live streaming, and IAP profiles on the social media platform Facebook, Instagram, Twitter, LinkedIn, YouTube. Follow IAP profiles on these social media to receive notification for our events such as webinars, workshops, CMEs, conferences, health camps, blood donation drive, and to know about recent updates on physiotherapy. Subscribe to IAP YouTube channel for notification of our live webinars. In playlist section of this channel, webinars are segregated into various folders on topic like orthopedics, neurology, sports and fitness, pediatrics, cardiopulmonary, women's health, research, cancer rehab, etc. for easy access. The social media links will be shared in the chat shortly. Now I will just hand over to the team of Tamil Nadu. Please, you can continue with the webinar.
Thank you, sir. Good afternoon to everyone. I'm Dr. Priya, Chennai Non-Zone Sub-Coordinator of Tamil Nadu IAPWC team, and also a moderator for today's webinar. I'm very much delighted to introduce Dr. K. Kamachi ma'am, MPT, PhD, DBDT, MIAP, MRCI, MD, Acupuncture, Associate Professor and Joint Director at ACS AMRI, Faculty of Physiotherapy, Dr. MGR Educational and Research Institute, Chennai. Dr. Kamachi ma'am is a highly accomplished academician and clinician with over 18 years of experience in the field of physiotherapy. She holds multiple qualifications, including bachelor and master's in physiotherapy, neurology, a PhD, and a diploma in basic developmental therapy, sensory integration, manual therapy, and advanced rehabilitation techniques. She has guided more than 80 undergraduates and 10 postgraduate students, published over 60 research papers, indexed in Scopus, Web of Science, and UGC contributed to book chapters and secured multiple funded research projects in the field of neurological rehabilitation and developmental disorders. Dr. Kamachi ma'am has been a resource speaker at several national and international conferences, including the Neurophysiotherapy Symposium, the Neuro Webinar Series on COVID-19, and the Illuminate Conferences 2023 and 2024. Her work has been widely recognized with prestigious awards such as MGR Research Award, the JC Bose Research Project Award, and Sir C.V. Raman Research Publication Award. With a strong academic background and clinical expertise and impactful research, Dr. Kamachi ma'am continues to inspire the physiotherapy community by advancing knowledge and innovative practices in neurological and pediatric rehabilitation. Now, she is here to join with us to share immense knowledge and insightful thoughts of the topic, the evolving role of physiotherapy in healthy aging, a comprehensive geriatric care. Ma'am, I kindly request you to start with your presentation now.
Thank you, Priya ma'am, for the introduction. So today's topic is the evolving role of physiotherapy in healthy aging, a comprehensive geriatric care. So the objective is that you will understand the importance of geriatric assessment, understand the various domain of the geriatric assessment, and the important role of physiotherapy in geriatrics. So introduction to healthy aging. So the World Health Organization defines healthy aging as a process of developing and maintaining the functional ability that enables the well-being in the older age. So approximately by 2050, 1 in 6 people will be over age 65. So rising the life expectancy increases the chronic disease burden, and India's elderly population, it will reach about 319 million by 2050. So importance of geriatric assessment. So going for the physiotherapy treatment, the main role of a physiotherapist is to do the assessment properly and to do the evidence-based practice with giving a right intervention. So the key factors why geriatric assessment is important is that a comprehensive health evaluation, that is to understand the overall physical, functional, cognitive and psychological status of the elderly patient. And next is to individualized treatment planning. So it helps us to promote a personalized physiotherapy intervention based on the medical history, functional limitation, and mobility status. And next, the fall risk identification. So you're going to assess the balance, gait, muscle strength, environmental factors to prevent the fall and related complication. And early detection is really very important because early identification of the functional impairments and age-related conditions like sarcopenia, osteoporosis, and you can improve the outcome. And next is the holistic care approach. So considering the poor morbidities and the medicational effects, cognition, and the emotional well-being, you have to deliver a safe and an effective physiotherapy. So that is why geriatric assessment is really very important. So goal is to promote the wellness and independence. You have to focus on the function and performance. It is going to be a multidisciplinary approach. And the efficiency is like ability to perform a rapid screening to identify the target area in which the population is affected and maintaining or improving the quality of life of the geriatric patients. So major components of assessment, you're going to go in for the functional capacity, fall risk, urinary incontinence, polypharmacy, like taking many medications, cognitions, nutrition, social support, vision and hearing, and financial concerns of the population. Patient information like general assessment, you'll be going for the name, age, gender, the address, occupation, comorbid factors, chief complaints, and the history of the present complaints. So demographical details you will be collecting, and then the chief complaints, pain history, previous medical history, previous surgical history, personal history like whether the sleep is affected, whether nutrition history, bowel and bladder function, family history, and drug history. So you're going to go for the analysis of the musculoskeletal, neurological symptoms, cardiorespiratory, special sensors, genitourinary, and investigation, whether investigation is performed previously, and looking for the socioeconomic status, like using different outcome scale. So one of the scale is modified Kupasamy scale, which is going to discuss about the socioeconomic status based on the education, occupation, and head of the family and monthly family income. So this also plays a major role. And this scale helps to assess the social and economical position of the urban Indian family. So you have to use the social economic status of the patient, psychological history, environmental history, and social history. So these are the basic geriatric assessment domains you'll be looking into: medical and physical, cognitive, functional, and social. So going for the medical and physical assessment, you'll be looking for the senses. So we'll be seeing the assessment one by one. So for vision, you'll be using the visual acuity, Snell's chart, contrast sensitivity, Alimton-Valley contrast test chart, peripheral field vision test we'll be using. For hearing, you'll be using the whisper voice test. And the somatosensory, you'll be checking for the sensation and proprioceptive sensations. So the depth perception, you have to check. Urinary incontinence, about the history, collecting the history and using the outcome measure. And next, you're going to check for the fitness depending upon the age factors. So about the flexibility, you'll be using back thrust test. For lower limb, chair test and reach test. For strength, you can use arm curls. Upper limb, for lower limb, 30 seconds chair test. So you'll be seeing how to perform these tests. And aerobic capacity like 6-minute walk test, 2-minute step test. So outcome measures, we have different types of outcome measure. So to analyze each domain like balance, we'll look for a functional reach test, tuck test, and then for fall prevention, vestibular moose fall scale, posture, going to check for the observation, and for pain assessment. So general observation, you look at the build, posture, gait, attitude of the limb, use of assistive devices, and spelling. And for general palpation, we check for the vitals, tenderness, spasm, and any other changes like jaundice, cyanosis, clubbing, edema, lymphedema, chest expansion, and excursion. So these are the general assessment you will check for the geriatric population once they come to you. And you go for the musculoskeletal assessment, check for the range of motion for the upper limb, lower limb, cervical, manual muscle testing in case if the muscles are affected. And in case of any conditions like Parkinson's, change in the muscle tone, okay, and you go for range of motion if it is limited. And then you go for manual muscle testing. You can use dynamometer, tightness, muscle pasting, joint play, then type of movements which is present, and the limb length discrepancy. So neurological assessment, basically we do for the central nervous system, peripheral nervous system, and autonomic nervous system. So we check for the orientation, memory, whether the patient is oriented, whether you'll be able to take the physiotherapy treatment and obey your commands. And after getting the consent, you go with the physiotherapy treatment. So orientation, memory, intellectual function, thought process, then going for the cranial nerve examination, since cranial nerves may be affected due to age factors. And next, go for the motor examination, muscle tone, strength, voluntary control, reflexes, and the sensory examination. And finally, the old age geriatric population will be having the bowel and bladder issues. So we know the importance of the outcome measures to be used as a physiotherapist. And it is going to be as an evidence-based practice. We are going to use an outcome measure and treat the patient and look into the pre-test, how the patients are performing the activity and how to enhance their functional activity by giving physiotherapy treatment. So the main idea is that you have to improve and enhance the quality of life in the patient, but it can be approved only by using an outcome measure, and the importance of the assessment and using the outcome measure plays a major role. So cognitive domain, so that can be detected or assessed by using a mini COGOS cog test, and which is a quick cognitive screening tool, which is used to detect the cognitive impairment in older adults. So it consists of 3 items as shown in the image. So a total score of 0 to 2 indicates a possible cognitive impairment requiring further assessment, and a score of 3 to 5 will suggest a normal cognitive function. So it is a very simple and a rapid and a useful for identifying the early dementia in clinical and community settings. So that is a scale which is used. And one more scale is the mini mental state examination. This is the scale which is widely used, and it evaluates the areas such as orientation, recognition, attention, calculation, and recall, whether the patient is able to recall, so that he'll be able to do the exercises which you prescribe for him, and depending upon the language and the visuospatial skills. So this has a total score range from 0 to 30. And when the score is from 24 to 30, it is considered as normal, and 18 to 23, it indicates a mild cognitive impairment. And less than 70 suggests a severe cognitive impairment. So this scale helps for screening, diagnosing, and tracking the progression of dementia and other cognitive disorder, which is going to be present in elder population. So this is the Montreal Cognitive Assessment Scale, which is having a very reliability and validity scale, which is used for a brief screening tool used to detect a mild cognitive impairment. So a total score of, this has a total score of 30 points. So higher score indicates a better cognitive function. A score of 26 or above is generally considered normal cognitive function. So this evaluates a multiple cognitive domains. So this includes the memory, attention, language, visuospatial skill, and executive function. So these 3 scale will enhance us to learn about the cognitive assessment in elder populations. So next we go for the cranial nerve alteration. So cranial nerve assessment is really very important because there's a aging changes that takes place in the geriatric population. So the first cranial nerve, olfactory deficit in function. So it is very important. Why is that in older adults? Because that may lead to a nutritional deficit or safety issues. So this was described by Larnell et al. In 2006, and importance of assessing the cranial nerve in geriatric population. And cranial nerve 2 is optic. Sometimes it can lead to presbyopia, so we have to check for the optic nerve. So it may contribute to impaired visual acuity, depth and motion perception, and contact sensitivities are reduced. So this was also stated by Larnell in 2006. The cranial nerve 3, 4, and 6, like oculomotor, trochlear, and abducent. So pupil generally small, they become smaller in size. So reflex response to light and accommodation becomes slower. So this also, it is really very important. and this was stated by Benassi et al. In 2006. Next is the trigeminal nerve restricted decreased lacrimal secretion. So, for example, after looking into the trigeminal nerve, we can also ask the patient to go and meet the physician and to take medication for this condition. So this also was stated by Abdul et al. In 2004. And next, auditory nerve, which is really very important. So hearing at the higher tones is lost and may cause older adult to respond inappropriate and misinterpret or confuse. So that also have the chance in decreasing the quality of life in elder population. And next you go for facial nerve, glossopharyngeal and vagus nerve. So decreased in number of taste buds. So sweating is decreased and bitterness may influence the nutritional intake also. So this was also stated by Obdel et al. In 2004. And the cranial nerve 11 and 12, accessory and hypoglossal. So delay in swallowing, which is going to affect, and it is possible for an older adult to experience dysphagia. So the importance of cranial nerve assessment plays a very important role. So you all know about the olfactory nerve, the functions. So as we'll go into a quick glance, like olfactory nerve for smell, optic nerve vision, oculomotor, trochlear-obsidian, extraocular movements, trigeminal nerve like sensation, face sensation, motor, muscles of mastication, facial nerve important, facial expression, taste, sensation to ear canals and palate, vestibular cochlear nerve, cochlear part and vestibular part, glossopharyngeal, sensation to pharynx, middle and inner ear, and of course the tongue, vagus nerve, sensation to pharynx and larynx, and motor, hypoglossal for motor to muscle of tongues. So the complete cranial nerve assessment plays an important role. So next, for a urinary incontinence. Urinary incontinence, we use urogenital distress inventory short form scale. So this is a questionnaire used to assess the distress caused by your urinary symptoms, especially in women with pelvic floor disorder. So this consists of a 6 key question, which will be focusing on symptoms related to urinary incontinence, urging, and obstructive symptoms. So each item in the scale, like 0, it is not all, and to 3, it is greatly, indicating the level of distress. So this scale helps to evaluate the symptoms, severity, and monitor the treatment outcomes in conditions like urinary incontinence and pelvic organ prolapse. So that is the important scale which is used for urinary incontinence. And one more scale is your incontinence impact questionnaire short form scale. This also has a person's quality of life across various domains. Like it has a set of 7 questions, and each question scores from 0 to 3. And the total score is summed and can be converted into 0 to 100. So this higher score indicates a greater adverse effect of incontinence in daily life and affecting the quality of life. So this is used to monitor and give an effective treatment over time and guide them regarding the management of incontinence for the patient. So somatosensory and vision sensory assessment. So you all know the visual acuity scale Snell chart is used, and contrast sensitivity test. We use a similar charts. So measured by using contrast sensitivity charts such as Hamilton-Bell contrast test chart. The person is asked to read all the letters they can see and for a special visual chart. So depth perception. So this can be used again charts to ask the patient using the index finger and to identify the depth perception, or the therapist finger to identify the depth perception. Then visual field restriction, you have to check for the peripheral vision, and using identifying whether she's be able to notice the examiner finger and trace the movements of the finger. So loss of central vision can lead to macular degeneration, which will enhance, which will go for falling in geriatric population. So vision is really very important to be assessed. The next is the vestibular. So vestibular is like the vestibular ocular reflex is very important because it is going to be helping the eye movements or focus the eye movements even during your movements of the head. So this should be normal in elder population. So ask the patient to relax, and the therapist have to hold the head of the patient and have to fix or look at the images in front of them, and you have to focus. So when the patient is able to focus, even when the head is moving side by, it is normal. When the patient provides a movement of the eyes or abnormal movements in the eye, that is going to lead for the vestibular ocular reflex, which is going to be affected. So somatosensory assessment is really very important. You're going to check for the proprioception and joint sense. Sometimes in patient with diabetes can also go for this loss, and vibration sensation, like placing a tuning fork at the first metatarsal, and that can be tested. And cutaneous pressure sensation and 2-point discrimination can also be performed. Hearing, like whisper voice test, which can be performed, and that requires a quiet environment, and standing 12 to 24 inches apart and whispering 3 to 6 words randomly, and the therapist whispers these words, and the patient should respond at least 50% of the word. So this scale is the hearing handicap inventory for adults, and this is a self-assessment tool used to measure the social and emotional impact of hearing loss in adults. So this consists of 25 questions, and each item is scored, like yes, if it is yes, 4 points, sometimes it's 2 points, and no, it is 0 point. And the total scores will range from 0 to 100. So this scale is used to assess the perceived effect of hearing loss of quality of life and guide appropriate intervention strategies. So when hearing is affected, that is also going to affect the quality of life in pediatric population. So functional balance and gait. So these plays a major role, like in fall prevention in elder population. So by doing Romberg's test, a positive Romberg affects the person demonstrates a substantially more sway or loss of balance when comparing a standing in Romberg position with eyes open for 20 to 30 seconds to standing in Rombergs with eyes closed. So when it's going to be a positive, you can suspect the sensory loss distally and testing the distal overlap sensation. So next, these scales enhance to check the balance in the elderly population. FIS-CIT, the FIS-4 test for static balance scale, is really very important. And the interpretation like that, it has a point of 4, like good static balance, 2 to 3 point moderate balance impairment, and 0 to 1 point poor static balance. So you have to perform a progressive difficulty standing position in the test, like feet together, semi-tandem stance, tandem stance, and one-leg stance. So this helps the clinician to evaluate the balance ability and the fall risk in elderly patients. Okay, next is the mini-BEST scale. This scale is often used to evaluate different aspects of balance control, particularly in patients with neurological disorder or elderly individual at the risk of falling. So this also consists of 14 tasks, and this helps to identify the specific balance deficit, plan appropriate rehabilitation, and monitor the patient progress over time. And next, time up and go test, tuck test, we usually perform, and this also assess the person's mobility, balance, and risk of falling, especially in older adults. And next is the 30 seconds chair test, which is used to assess the lower body strength, functional ability, and the endurance, especially in older adults. So these are the scales which are used to prevent fall. And next one is the mini-BEST test scale. This also is used for the evaluation, and this has a set of 8 questions. Next, the functional assessment. For functional assessment, this enhances the geriatric population to perform their radial activities independently. So for this, the functional assessment scale like Bartle Index, Lawton and Roddy, CATS, and many other scales, which is having a really reliability and validity scales, can be used. So CATS Index is an independence in the activity of daily living, is a tool which is used to assess the person's ability to perform the basic self-care tasks independently. So this has a 6 key ADL domain, like bathing, dressing, toileting, transferring, continence, and feeding. And this helps us to do the baseline functional status of the geriatric population, and it guides care planning and the level of assistance needed for the population and monitors the functional decline or improvement over time. So next is the Bartle Index of Activities of Daily Living. So this has a 10 item to be assessed, like feeding, bathing, grooming, dressing, bowel control, bladder control, toilet use, transfers, so from bed to chair, mobility like walking and stair climbing. So the interpretation is like 0 to 20, there'll be total dependence, 21 to 60, severe dependence, 61 to 90, moderate dependence, and 91 to 99, mild dependence. 100, the patient will be, genetic population will be independent. So the clinical implication of this Bartle index is that this is used to evaluate the baseline functional status, guiding rehabilitation plan, and monitoring the recovery or decline over the time. So this will be used whether there's an improvement after giving your physiotherapy treatment or enhancing the quality of life of living. Next is the psychological domain. So this also plays a major role. So counseling is required. So we have to talk with the family members and what type of problems the geriatric populations are facing. So two important scales like geriatric depression scale and WHO quality of life brief scales can be used. So the geriatric scale helps to screen of the depression in older adults using 15-item questionnaire. This is a 15-item questionnaire. So 0 to 4 will be normal, no depression. 5 to 8, mild depression. 9 to 11, moderate depression. And 12 to 15, the patient is gone for a severe depression. So next is the QOL brief scale with 26-item questionnaire. So this also is used to assess the quality of life in 4 domains. So first one is the physical health, psychological, social relationship, and environment. So this is this domain is also really very important because you have to give counseling to the geriatric population and bring back them to the life. So next you're going for the environmental assessment. So why environmental assessment is that either that is going to affect the geriatric population. So what type of house, whether it is a crowded area, whether the flooring is not safe for the geriatric population, whether the environment or the dark or light having the influence on their mood swings, and color of the room, the staircase, whether it is not very with architectural barriers, they find it difficult to go up and down the stairs. So whether railing is present or absent, and what about the toilet facilities, spacing nearby the bedrooms, height of the bed, chair. So these are all the factors which is going to have an influence on the geriatric population. So how many handles attached to totally in the house where they can be roaming or in the toilets, what type of footwears they are wearing, and obstacle near the rooms are the outdoors. So this environmental assessment will also enhance the geriatric population to have a better life. Next is the home safety self-assessment tool. So this helps to identify the potential fall risk and safety hazards in an older adult home. So each item is scored whether it's going to be safe or unsafe. So the higher number of unsafe scores indicates the increased fall risk and the environmental hazards which is going to be faced by the geriatric population. Okay. So next is the social life assessment. So the geriatric population, they feel whether they are isolated or they attend the family function, they attend the social gathering. So how about the anxiety, depression, and family disputes, fear, family support or not, or about the spouse. So this gives a social life assessment of the geriatric population. And next is the nutritional status. So the mini nutritional status also has an influence on the geriatric population. And this is a validated tool which is going to screen the malnutrition risk in the older adults to the questionnaire and on the dietary intake. So what are the key reasons? Why should you know about the outcome measure? Why a physiotherapist should know about the outcome measure while using an assessment is that first, objective evaluation of the patient is really very important. So the scale is going to provide a standardized, reliable, and a quantifiable data on the physical, cognitive, psychological, and functional abilities, which is going to reducing the subjective bias in the assessment. So that's very important. Next one is the early identification of the problems. So the tools like mini nutritional assessment or the geriatric depression scales, which we saw, will help to detect the malnutrition, depression, fall risk, or the functional decline early. So allowing timely intervention to prevent the complication. And next one is by using these outcome measure, you can personalized treatment planning can be done for the individual. So outcome measures guide a physiotherapist to design an individualized goal-oriented intervention based on the patient's specific impairments and needs and improving the effectiveness of therapy. And next one, it helps us to track the progress over time. So repeated use of scales enables the monitoring patient improvement or where they become stagnated or deterioration takes place or helping to adjust the treatment strategies and demonstrate the treatment effectively. And next is the communication and documentation. So by using all these outcome measure, a standardized outcome measure facilitate a clear communication among the healthcare professional, and that will provide a legal documentation of the patient's status and a clinical decision making which can be done during your geriatric care. So as I told you, geriatric assessment is a comprehensive health evaluation, and that can be used for individualized treatment planning, fall risk identification, early detection of the functional decline, and an holistic care approach. So that is why the outcome measures are really very important, and it can be used for the evidence-based practice in your clinic or in settings. So role of physiotherapy, as you all know, it is to address the functional limitation in the geriatric population and to encourage and maintain an healthy lifestyle, to provide a safe environment for the geriatric population and a referral to other specialties if required, and to educate the elderly population about the various service and support that is available for them. Okay, many geriatric population will not be aware of the facilities which is available. And conducting assessment at home, the assessor can observe the family situation and address the potential barriers which the geriatric population is facing. So for a physiotherapist, particularly in the geriatric side, the communication strategies is really very important. So you introduce yourself and you have to face the person directly, sit at a high level, so speak slowly so that the patient can understand, ask open-ended question. So if you're doing the assessment and you see if the patient is having hearing deficit, raise the voice volume accordingly and allow the ample time for the person to answer for your questions, relevant questions. So geriatric physiotherapy, it became a specialty in physical therapy study in 1989. And since then, physiotherapists have worked to understand the problem of aging. So there's a long list of problem dealt with in geriatric population. So this is a very vast topic. And some of the problems which is listed here are health problems like joint problem, impairment of special senses. They face cardiovascular diseases, hypothermia, cancer, prostate enlargement, diabetes, accidental fall, Alzheimer's, arthritis, balance disorder, incontinence. So they may have 2 or 3 problems combined together. So they go for joint replacement as age increases, pulmonary disease, stroke, and also they have a psychological problem like emotional disturbance, senile dementia, Alzheimer's disease, suicidal thoughts, tendencies, and social problems also have an influence on geriatric population like poverty, loneliness, dependency, isolation, elder abuse, and generation gap. So these are the major problems which are faced by the geriatric population. So 3 major groups. And since physiotherapy for geriatric problem in these conditions is really very vast, we take about 3 major groups. So which is really very important is deconditioning, cardiovascular disease, and musculoskeletal problems. So first we'll address all these major groups. So three major groups like deconditioning. Problem happens when because they do not do any type of exercise or they sit idle. So they don't use their limbs. So these problems can be addressed by reconditioning through a range of motion and other type of exercises like strengthening, aerobic conditioning, range of motion exercises, and free exercises. So cardiovascular diseases like heart disease and stroke. So exercises to enhance their quality of life, then aquatherapy, electrical stimulation, and more. Nowadays, we use virtual reality, many type of treadmill training, many advanced techniques are used in pediatric populations. Then musculoskeletal problems. So we address what type of musculoskeletal problems they are facing, and the treatment can be given accordingly. So these problems require special attention as osteoporosis make the patient very frail and osteoarthritis is very painful. So this depending upon the individual assessment to the geriatric population, and the treatment can be given. And fall prevention is the major role in geriatric population. So geriatric physiotherapy is responsible for preventing many falls because to work with the balance and gait. So the quality of geriatric physiotherapy depends upon the profound knowledge, caring attitude, good communication skill, and ability to think out of the box and give treatment according to the patient. So it will be an individual planning program depending upon the patient. As we all know, geriatric is a patient can be treated only with a multidisciplinary team. Okay, so the concept of geriatric teams is best with the assessment and management of disease and disability in elderly population. So the team consists of a physician, physiotherapist, occupational therapist, ophthalmologist, audiologist, psychiatrist, dietitian, nurse, and a social worker. So it is going to be a multidisciplinary approach and work as a team to build the quality of life in the geriatric populations. So aging is not a disease. It is a natural condition that needs to be nurtured and advanced. So geriatric rehabilitation involves prevention along with treatment and accommodation along with restoration. So this is the concept which is going to be followed for healthy aging. And these are my references. Priya ma'am?
Yes, ma'am. Thank you, ma'am.
Thank you.
So here I'm starting with our friends. On behalf of the organizing committee, I take this opportunity to extend a grateful pleasure to Associate Professor and Joint Director, ACS AMRS, Faculty of Physiotherapy, Dr. NGR Educational Research Institute, Chennai, for our insightful and enlightening session on evolving role of physiotherapy in healthy aging, comprehensive geriatric care. Our expertise drawn from years of clinical practice, research, and academic contribution has given us a deeper understanding of how physiotherapy can holistically enhance the quality of life in the elderly. The practical perspectives and evidence-based approaches she shared will undoubtedly inspire us to integrate physiotherapy more meaningfully and comprehensive geriatric care. We sincerely thanking Dr. Kamachin ma'am for taking her time and sharing her knowledge with us. Will surely benefit for both professional and community at large. I also extend my gratitude and thankfulness to IAP for all their support for her Tamil Nadu IAP Women's Health team for all these 8 days of webinar series. And also I thank all the participant fellow colleagues and the organizing team for making this session successful. Thank you, ma'am.
Thank you, ma'am. And then I also want to thank the Tamil Nadu team for giving me this opportunity. Thank you.
Thanks to everyone. I just request everyone, please subscribe IAP India YouTube channel and other social platform to be get in touch with all the latest webinars and the latest activities of IAP India. Thanks to the Tamil Nadu team. Thank you.
Thank you, sir.
Thank you, sir.